Hello, good evening, everybody, and welcome. This is Jeff Blake from Blue Shield of California Communications. We want to thank you for joining us for this Q&A with our top physician leader, Terry Gilliland, MD. A quick disclaimer, we won't be providing any medical advice, but we will get to benefit from Terry's decades of experience in healthcare to answer your COVID-19 questions that have come in through Facebook. So Terry has experience in the past as a surgeon, as a hospital leader and health system leader, and then for the past several years as a physician leader in the health plan at Blue Shield, where our mission is to ensure all Californians have access to high quality care at an affordable price. So without further ado, I'm going to introduce Terry Gilliland. Dr. Gilliland, thank you so much for being there.
Yeah, thank you so much, Jeff. It's really a pleasure to be here and to take a little bit of time, and thank you for taking time out of your busy lives and days. The question that I get asked most often by family and friends is, what the heck is going on? And is this going to affect me and my family? And if somebody gets sick, am I going to be able to see them in the hospital? And so maybe to just back this up to a different level, this was not on our minds 3 months ago. And certainly it is front and center for us right now. If you kind of take the roll-up view of it, this has been something that's challenged every single society in a slightly different way, depending on what their government looks like, what their hospital infrastructure looks like, what their testing capability looks like, and then what their society looks like. And so if you think about countries such as South Korea, they were kind of made for coronavirus because they have centralized lab testing, they had extensive capabilities to get the test done, they had a society that was generally compliant in a limited outbreak, and they had government that was tightly connected to all of those things. And so they could, when it first hit, they could clamp it down quickly and say, we're going to isolate. They never did shelter in place. They just selectively isolated because they had the testing capability. Flip it around to a little bit different country like Sweden, who has the capability to test, but they also have a philosophical point of view that says, you know what? Some of us might not make it, and we're okay with that. And so they've literally kind of taken a let her rip approach, and it will run through their society quickly. And certainly there are some people that will not survive from it. And then take it over to a place like the United States, where we've now experienced a widespread outbreak across the United States, especially in New York City. There are not too many New Yorkers who are saying anything like the Swedes that, yep, it's going to rip through us and some people are going to die, and we're okay with that. In fact, nobody's okay with it in the United States. And so as we've seen the counts rise from literally a week ago, it was somewhere in the 100,000 range. And now it's all the way up to and including nearly 1 million people. It'll be 1 million people by tomorrow for sure. And there are 200,000 in the United States. So what's that mean? It means that this coronavirus, to describe it in a little bit simpler fashion, is it is an explosive, very efficient virus. It infects people easily. It infects people from 1 to maybe 3 or 4, it might be 7 or 8. And many of those end up being asymptomatic. And so there are people that are carrying this and actually spreading this, and they don't even know about it. And there's a small subset of people that get really sick from this. And it tends to be people that are older, but it's not just the older people. We're now seeing it certainly in young people, young, healthy people. And what happens is that the virus basically creates enough of a load in the body so that your body responds to it. It's trying to fight it. It's doing the right thing. But it results in what's called a cytokine burst, which is inflammatory mediators that are there to fight the virus. The problem is that it fights it so well that it can make it very difficult to oxygenate your lungs. And regardless of being on a ventilator or not, it's a particularly poor prognostic sign for you have to go get assisted breathing with a ventilator. So it is a little bit scary. And certainly for some who get to that point, it's not a very positive prognosis. And so that's why, when people ask me, okay, so how do I keep this from affecting me and my family? It's really about getting to this place where we can shelter in place like we're doing broadly in the United States, really respect that order, make sure that we're very careful with how we approach people and circumstances, maintain that 6-foot distance. And hopefully with this shelter in place, we can effectively hit the pause button, which is what we've done. And the pause button allows us to get to the place where we can now ramp up our testing capabilities and really quickly figure out who's infected and then isolate them so that they don't infect others. So that's the overview. That's the lay of the land, Jeff. And it's very interesting to see how this is progressing, but it's progressed a lot faster in the United States than anybody would have thought.
Right. And just to touch back on the social isolation measures, how do we get a sense of how well they're working, especially in places like California, where we've been at it for a couple of weeks?
Yeah, we're really fortunate in California because very early, in fact, on March 16th, we had a 7-county order in Northern California, and then 3 days later, an order by the governor of California, who made a very bold and early action that said, we're going to shelter in place. And the good news is that now, 2 weeks later and a little bit, we're starting to see some signs that it's actually working. That's really good news. And we're not quite through it yet. I think we need probably at least another 10 days to really see us getting over the hump in California. And because Southern California was not quite as early to the show for shelter in place, and they were doing some things socially that was not quite as good for social distancing, I think that LA is going to have more of a challenge than Northern California.
Yeah. A related question just about the virus that has come in, I see on the comments from Shireen. Is there a reinfection risk once you've had it?
Yeah, thanks for asking, Shireen. It's super interesting because there is some notion right now that you can be reinfected, but generally, if you have an infection that's strong enough to drive an immunity response, there are 2 waves of different kinds of antibodies. One's a very early antibody, and then there's a longer-term antibody. Once that longer-term antibody is up and running, you're probably good at least for a year, but it's way too early to know. Most of the time that antibody does last for a while, but right now we just don't know how long it's going to last because obviously we're early in the experience right now.
Thank you. Another question that people are asking, this is a question that we got from Diane on Facebook. Should, quote, healthy and or those who are not experiencing symptoms start wearing masks in public? Or more broadly, what advice do you have for generally healthy people or asymptomatic people who are out there, living their lives and trying to get their needs met?
Yeah, well, thank you for asking, and it's a little bit complicated, but not that complicated. First of all, is that if you're wearing a mask that a first responder or a frontline healthcare worker would otherwise be using, those are probably the people that need it first and foremost, because the rest of us have the luxury, really, of keeping that 6 feet, and certainly healthcare personnel don't have that luxury. In Italy, as an example, 30% of the people that were infected with coronavirus were in fact healthcare workers, and we want to avoid that circumstance in the United States. However, if it makes you feel more comfortable, there's no harm in wearing a mask. It's not nearly as effective if you're already keeping that 6-foot distance, but if you're up close and personal, which again I would not recommend, then it's fine to wear a mask.
Okay, appreciate that. A few other questions are coming in. We've got a few different questions related to other conditions that you might have. One is related to type 2 diabetes. The question from Kristen is, why are type 2 diabetics more at risk if we contract COVID, and what can we do to be in a better position if we do?
Yeah, thanks for asking, Kristen, because it's really important for people to know that certainly if you have other chronic health conditions, and diabetes mellitus is one of them, diabetes type 2, and the reason why is that diabetes in general affects your immune system, and especially if you have higher blood sugars. And so one of the things that you can do to help yourself is to make sure that your blood sugar is relatively tightly controlled. Now, you, of course, don't want to get it too low, but having it in that relatively tight range will make it so that your ability to fight infection remains as good as it can get.
Very good. Another couple of questions that have just come in is about sort of similar to the reinfection question is if you have contracted COVID-19, at what point are you no longer contagious, or do we not know the incubation rate yet?
Yeah, thank you very much. And I missed the name of the person that brought that in.
That was Junior.
Junior? Okay. Yeah, fascinating question. And so what we know is a couple things. One is just from how viral loads tend to shed. And there's a period of time that we think with coronavirus, I've read about sometimes even before symptoms occur with coronavirus, that people are shedding virus and they don't know about it. Certainly the peaks shedding of virus is somewhere between days 2 and 11. It might get out to 14, depending on how things go. And there are also some reports that suggest, nothing really confirmed, that says that people can be shedding coronavirus even after 14 days. But if you think about the peak shedding, it's a little bit like of a bell-shaped curve. There's going to be a peak to the shed, and that's probably somewhere around day 5 to 11 or so. And then it should tail off after that to eventually it's gone. And then you're not shedding virus anymore.
Thank you for that. A couple other questions about other related conditions. One is about asthma. I think we've all seen that there is some sort of higher risk for people with asthma. Broadly, what is that risk? Why does that? Why do people with asthma have a higher risk?
Yeah, thanks for asking, because a lot of friends that I have are asthmatics, and they're quite concerned, and rightly so. It's not that asthmatics per se make you more susceptible to the virus. It's just that your lung capacity and your lung capabilities to weather the storm of a coronavirus, should you get to that point, is not nearly as robust as somebody that has normal lung function. Other than that, it's nothing per se about asthmatics, but you should be particularly careful because obviously your lung function is not the same as somebody who's not asthmatic.
Mm-hmm. Very good. Another question that people are wondering is, Alyssa asked, what does the research show, if we have any, for pregnant women becoming infected with COVID-19? Do we know of any cases or any research?
Yes, thanks for asking, Alyssa, because there have been a number of pregnant women who become infected. And from what I've been able to read about it, again, not a lot of great reports coming out, then they go to the hospital and they deliver their baby. And to the extent that COVID-19 gets cleared from them, then they get better. And I've not heard of any pregnant women so far, knock on wood, maybe it's just something I don't know about, who've actually died while in labor or because of COVID during that pregnancy.
A related question that came in a few minutes ago, I didn't get the name, was about, of course, this is a sensitive question too, but about the fatality rate by age group. Is there a sense of, a lot of times with, different kinds of flus, it might affect the elderly or the very young. Some of them affect healthy people, who are in their 20s and 30s. How is this one seem to be playing out?
Yeah, it's a good call out, because certainly it has a much higher mortality ratio. That's the number of people who become infected on the denominator and the number of people that pass from it. And it's a real exponential curve as well. So as you get older, actually people who are 60 and older, 70, 80, 90, those have progressively higher mortality rates. But the interesting thing is that, and particularly in the United States, when this started to hit Italy, there was a lot of press that said, yeah, those guys are old and they're not very good shape. And what's really changed when it hit the United States is that it's very clear that it affects younger people as well, and sometimes younger healthy people. And so I just say that there isn't any of us that ought to be out there playing basketball down the street in a pickup game. We ought to be all cautious about how this can spread to younger people and have a significant impact.
Very good. An interesting question just came in from Nathan. Dr. Gilliland, I know that you have a close relationship with a lot of our providers and hospital systems. The question is, in your area in California, are you seeing or hearing from colleagues about the activity in hospitals in terms of patient load and limitation of resources? How are our hospitals doing, basically?
Yeah, thanks for asking, Nathan, because this is a critical thing. Remember that interdigitation between the government and society and testing and hospital capacity. And so in California, certainly we are monitoring this very closely. The state has good visibility into it, but also from certainly the payer side. And what we're seeing right now is that there's not capacity constraints. There are not people being turned away. There are enough ventilators. There's enough personal protective equipment. So far, so good. And based on the modeling, it's just modeling until it happens in reality. We're hopeful that we won't have supply resource constraints in our hospitals.
Okay. There's a couple of questions I might combine into one that are related to telehealth. And so I guess broadly, can you talk a little bit about telehealth, I guess specific for Blue Shield members? And I guess what is out there, and one specific question is, can you get screened for COVID-19 using telehealth?
Yes, well, certainly. And screening for telehealth is available using some apps, and it's also, of course, available through Telehealth. We happen to use a Teledoc platform for our members, which allows for screening that is free of charge. There's no copays or any other barriers to getting that screening. And then once you go through that criteria, then what Teledoc is doing is to refer you and create a seamless transfer to the local California Department of Health based in that particular county, and then you can go and get tested.
Very good. And do you think, have we seen any increase? I'm assuming it's a yes, but what can you say about the utilization of telehealth as far as you've seen it over the past few weeks?
Yes, thanks for asking, because most of the providers, whether it's American Well or Teledoc, they're seeing about 150% increase in their volumes, and they're managing it very well now. Good news is that they're also bringing up other providers into that platform so that there's enough access. I think in early times, there was sometimes a longer wait time than people would have wanted, but it appears that they're meeting the needs of the population right now. So it's a great avenue. Very good.
We have a couple of different questions that are related to risks inside the home. So one person was asking about, if you are in isolation, are you still okay to touch your face as long as you use good hand hygiene, or are you somehow getting it from, the question from Jennifer was, can you get exposed through objects like grocery items, produce? I mean, I've heard a lot about that, but what's your sense on that idea?
Yeah, it's a good question, Jennifer, because I don't know if you read the newest Santa Clara County order that it was extending sheltering in place, and they have restricted or eliminated, actually, you can't bring your own bags anymore to stores. And the idea is that people who are infected, or those who don't know that they're infected, could potentially transmit through those types of vehicles. I just offer that there's a lot that's unknown right now about how this virus spreads, certainly through aerosolization, that is through your mouth and particles that come out from just breathing. What's not known as much is how long the virus lasts on a variety of different surfaces, just because it's so new. And as we get more experience, and by the way, coronavirus is going to be around. It's not an existential threat to our society. We will get through this. And a lot of the things that we would normally know, we just don't know right now. But you can figure that viruses tend to last on surfaces for a period of time. And so it's always worthwhile to be cautious about washing your hands and making sure your surfaces are clean, and making sure that you're, if you are going hand to face, and that's a pretty easy habit to get into, that you wash well afterwards.
Very good. This is just sort of another kind of broad question. This is my question for you. Have you, over the past few weeks, have you seen anything that really surprised you, something that was counterintuitive? I did not think that was going to be the outcome, just related to either the response or society more broadly? What has surprised you?
Yeah, what surprised me is how much this has been different depending on where you are. And so if you're a South Korean, this has been very different experience than if you're in Sweden or Iran or Italy or Spain. And it's just fascinating to, it's not funny, but it is fascinating to watch how different societies are dealing with this in a different way and making choices, if you will, either on a societal basis because they don't want to self-isolate or they don't want to do social distancing. The choices that they're making as a society are pretty profound, and they're having effects on the entirety of the population. I'm really thankful to be a Californian. I'm really thankful to be an American, because I do think that we're going to get through this. But certainly there are other parts of the world that have been surprising to me about the choices that they're making. Maybe because they didn't have any other choice to make, but certainly some of those are making fairly conscious choices about how they're approaching this pandemic.
Right. Wow. Thank you for that. One other question from Nathan. I might paraphrase a little bit, but and you touched on it just before about how you're like thankful to be a Californian. I am as well. Do you think there is more that we could be doing, or what, I guess, the response to, I guess maybe from the maybe at the state level or from our local level. Is there more that we could be doing to try to flatten the curve, or do you think we're doing the right things at this point?
I do think that we're doing the right things in general. I will say that I'm an observer of human behavior, and so I walk right down the street and there's a public basketball court where people are playing 3-on-3s, and I'm thinking, well, okay, there's 3-on-3. I hope they all live together, because if they don't live together, then they're placing themselves at risk and the people that they're in contact with. Similarly, I know some people in the Bay Area, and they might go play golf with their dad. And when you think about the risk to that dad, he might be 85 years old. That person who's going to play golf with their dad is effectively exposing their dad to every other single person that they're exposed to in their circle, whether it's their wife or their kids or their friends. And to the extent that some of their kids are getting out and being with their friends, that's just really, it's really risky behavior from my point of view. And so I do think that there's more we can do based on the stories that I'm hearing about being even more vigilant about this social distancing and sheltering in place. I know it, I get it, I get a little bit antsy myself, but it's just super important right now to really respect that order and to do the very best you can to make it so that we can shut this down, because if we can shut it down, then we can manage it.
Yeah, that's right. A couple of people have asked, maybe I won't get too specific about the sort of potential treatments, but I guess maybe broadly, are there trials that we're hopeful about? Are there treatments that might be coming up, or a vaccine? I think people have heard a lot about this 18 months away. Anything you want to share about kind of what we think might a vaccine or even treatments look like in the near term?
Yeah, well, thanks for asking. There's a bunch of very encouraging treatments from my point of view about hydroxychloroquine. Chloroquine is the original drug, super old drug back in the 1940s. And it's, for any of us who traveled outside the United States to a malaria-prone region, it's the drug you take. It's not that fun to take. But what I've just read is how Italians are now just saying, you know what, forget it. We're just going to use hydroxychloroquine and do it empirically and hope that it works. We'll figure out later if it's evidence-based, but this is ravaging our country, and we want to do something in advance. We'll find out more about that over time, but I'm encouraged by what we're seeing so far. Flip side of that is don't go out there and try to get your own supply of it. This is really important to have and save for the people who are sick, but that's one thing that I think is going to be helpful over time. With respect to the vaccine, nothing different than what you're reading. I'm hopeful that there are so many companies that are trying vaccines that will be able to understand the efficacy of the vaccine and how long it actually confers immunity in those that have been vaccinated. But again, that's going to be a little bit of time there.
Yeah. All right. I know we have a few more minutes left. I have another interesting question about sort of maybe two different questions related to sheltering in place and sort of our self-isolation. One is about what happens when the regulations are over. In what ways should we continue to protect ourselves once it's no longer a mandate? I think that's kind of an interesting one. What do you think maybe a one step down might look like?
Yeah, it's a fascinating question. And I would say that the best information that I have is that we'll enter a phase where people will not be actively infected nearly as much. And we're going to want to know, so who's immune to this? Who was exposed and didn't know it, was asymptomatic, who's had it in some fashion and has been diagnosed. That's where the blood tests are going to start to come into play, because it looks like we'll be able to develop some that are fairly rapid, fairly easy to interpret, might be self-administered, not currently FDA approved for that right now, but we're going to be able to understand what percentage of the population has actually been infected or is currently infected, and then be able to understand the risk to the rest of the population if we just go back to our normal lives. One of the reasons why there's been explosive growth in places like New York is it hit a very dense population, and they were native to this. They'd never seen it before. No one was immune. Now, if you take an example where, let's just say 50% of the population is immune, and it were to come through there again, it's only have even an opportunity to affect the 50%. And so the kind of current wisdom says that once you get up into the 60 to 70% of the population that's been infected at some point, or has immunity, then it's really hard to have a pandemic because it's just not going to rip through society and transmit nearly as effectively or as efficiently as it is currently.
Mm-hmm. Very good. Couple other questions while we have another couple minutes. One was about, I think I can scroll up here, about what can employers do? I'll ask the question, I'll read Sarah's question, and maybe I'll paraphrase it for a little more broadly. But Sarah's question is, what can employers do to support their employees to encourage social distancing and maintain their safety? Do you want to share a little bit about what Blue Shield of California did to try to make some changes for our employees?
Yeah, certainly. And thanks for asking, Sarah, because and I'm very thankful for Blue Shield and how we approached this. But after that first weekend in Washington where we knew that there was community spread, we immediately went to canceling our large leadership event. We started making turns immediately that said, okay, within 10 days, we want to make it so that people can be working at home, and with the support of our colleagues in IT and in our call centers, we have been able to move everyone remote in a really rapid period of time. And as a result, knock on wood, we don't have any Blue Shield employees that have acquired coronavirus from the workplace. So we're very proud of that. What employers can do in general is, and there's some critical functions, they're still essential businesses, is that you can protect your employees by either having them wear face masks in the worst place and or being really stringent about making sure that people are just not in close association with each other. Of course, clean all the surfaces in the bathrooms and have people do the hand washing. That's what employers can do now to make it so that if you do have to be in the workplace, you're really limiting and mitigating the risk there.
Yeah, I think we're going to do 2 more questions, and then we'll let you continue with your day. One that is, sensitive for me as well, and maybe you also. I want to make sure I get the name here. This is from Janessa. She wants to know, is the risk truly low for children? As a parent, what is your advice for other parents during this time?
Yeah, Janessa, that's a fantastic question. And certainly some of the people that I know, they're pretty concerned about their children because you've probably read some reports that this can affect children. In fact, it can result in a fatality. It does appear, though, that children are not nearly as, in general, severely affected as adults if they're healthy. And so I would treat your children just like any other human. You'd want to make it so that you keep them 6 feet from anybody that's outside your household and take care of them just like anybody else. They certainly can transmit the virus just like anybody else. And so I'd say, don't worry about them more than you would for yourself, and treat them just like you would for yourself, and make sure that you're protecting them just like you would anybody else that you care about in your home.
Very good. All right, so our last question is just kind of a nice way to end. I wonder, is there anything that we didn't touch on, or is there something that you would like people to know, Dr. Gilliland, that sort of, I know I heard you mention we will get through this. That's always a nice way to kind of, maybe you can expound on that, or is there something that you would like people to know to take away from this conversation or kind of the last 3 weeks of our shared experience?
Yeah, well, thank you for asking. And I would just close with saying that I have so much existential confidence and optimism that we are going to get through this, and we will. And we don't know a lot of things that are going to happen in the future, but we do know that we as a people, as a society, we will prevail, and we're going to persevere. And there's going to be some things here with coronavirus that are likely to hurt us. There are probably going to be some people that we know that may be severely affected by it. And so continue to manage yourself, manage your surroundings, do those things that keep you resilient and vibrant and active, and you can pass that to the people around you. But just be optimistic and know that we're going to get through this.
Very good. With that, I want to thank everyone for joining us. Thank you all so much for your questions and, really thoughtful questions for our Dr. Gilliland and Terry. Thank you so much for sharing your experience with this. And hopefully we can do this again soon. And maybe as we learn more, we'll continue to kind of provide that feedback back to people and hopefully, give people that confidence that we will get through this. So thank you so much, Terry. Thank you everyone for joining and for your questions, and stay safe.
Thanks, everyone. Have a great day.
Thanks.